According to an article released in the Harvard Special Health Report in 2009, the odds are that you or someone you know has diabetes already or is at risk for developing this disease. Nearly 21 million Americans, or roughly 1 in every 14 people, have diabetes, and many more are at risk. I never knew how diabetes could change a family's life until my stepdad got diagnosed with type 2 diabetes in 2011. Since then, we have had to strategically plan our meals and cut out a lot of our go-to recipes for dinner. My objective for this speech is to define what type 2 diabetes is and also to inform you of the risk factors and warning signs of this disease. A publication from Health A to Z defines diabetes as a disorder that affects the way the body processes and uses carbohydrates, fats, and proteins. When your body no longer responds to the insulin that your pancreas is producing, you become insulin resistant. At this point, you are considered to be a type 2 diabetic. This same article states that if this disease is left untreated, it can lead to blindness, amputation, severe kidney damages, and in some instances may lead to death. Now that I have defined type 2 diabetes, let's discuss what factors put you at risk for this disease. When my stepdad was diagnosed with this disease, I was forced to learn everything about it. One thing I took away from this experience is that being obese will put you at the top of the risk chart for the type 2 diabetes. However, there are more factors to take into account if you think you or someone you know might have diabetes. An article by Ann Carter also suggests that a family history, being older than 40, high blood pressure, high cholesterol, or an inactive lifestyle is also risk factors for this disease. I have only named a few of the risk factors, but the ones I have discussed are most commonly discovered. The final piece of information I feel is important to know about type 2 diabetes is the warning signs of the disease. According to a publication in the Gale Encyclopedia for Alternative Medicine, the early signs of type 2 diabetes are tiredness, extreme thirst, and frequent urination. It also suggests that it is common for type 2 diabetes to be detected while a patient is being seen by a doctor for a health concern caused by the yet undiagnosed diabetes. Taking all things discussed into account, I hope you have enough information to decide for yourself if you or a loved one needs to be screened for type 2 diabetes. Important factors to keep in mind are: when your body no longer reacts to insulin, you are considered to have type 2 diabetes, and if left untreated, it can be life-threatening. Genetics, weight gain, and inactivity are all key factors for this disease. If you experience a change in your fluid intake and output, you may consider being screened. A publication released in 2007 suggests that people who maintain a good control over their blood sugar level, reduce their weight, and exercise regularly can have a normal life expectancy. Living in a household affected by type 2 diabetes has really changed my outlook on this disease. It is a complete lifestyle change and requires much needed attention in order to keep my stepdad as healthy as he can possibly be.